Seniors often hear nuts are healthy, but the reality is far more nuanced. Some nuts offer powerful health benefits, while others can quietly undermine wellness as we age. This guide reveals the 4 worst nuts to avoid and the 4 best nuts to include daily for healthy aging. Understanding the difference can make a profound impact on heart health, inflammation levels, cognitive function, and even longevity. First, it's important to note why some nuts might cause harm. Many commonly available nuts come either heavily salted or are high in calories, refined oils, or compounds that may stress aging organs, contribute to inflammation, or interfere with medication. Seniors need nutrient-dense, antioxidant-rich foods that support vascular health, preserve muscle and bone, and protect the brain, and that means being selective about which nuts to eat. Let's begin by addressing the worst offenders. These are nuts or nut-like legumes that may elevate blood pressure, worsen inflammation, burden liver and kidney function, or spike calorie intake in ways that health-conscious seniors should avoid. Peanuts. Technically legumes, peanuts contain anti-nutrients that may irritate the gut. Even raw peanuts often come roasted in inflammatory oils. They are also among the most allergenic nuts. Moreover, peanuts are prone to aflatoxin contamination, a toxic byproduct of mold that can harm the liver, even in small, repeated exposures. Peanuts top many blends and butters, making them an often overlooked risk. PMC.NCBI, LM.NIH.gov Plum 115 Health for United States, Medium.com Plum and 15 UTU.BE Plus. 15.2. Salted roasted mixed nuts. High sodium content is associated with elevated blood pressure and fluid retention, especially concerning for older adults. Many store-bought mixed nuts are coated in refined oils, sugar, or salt. These offer few nutrients in proportion to their calories and may contribute to metabolic dysfunction. 3. Macadamia nuts, overconsumption. While macadamias are rich in monounsaturated fats, consuming large portions can quickly exceed daily caloric needs. 1 ounce provides over 200 calories, perfectly fine as an occasional treat, but potentially problematic if eaten casually in the quantities often associated with nut bowls or baking YouTube. Compluv 7realsimple.com plus 7realsimple.com Pluv 7.4. Brazil nuts, if consumed excessively. Brazil nuts are nature's richest dietary source of selenium, but high selenium intake, more than a few nuts per day, can lead to toxicity, brittle nails, fatigue, gastrointestinal issues, and cognitive fog. Seniors with thyroid concerns or on certain medications should be especially cautious. Healthline.com. These are the ones that seniors should avoid or consume with great care. But that doesn't mean nuts should be excluded from a healthy aging diet. When chosen wisely, nuts deliver fiber, healthy fats, plant protein, vitamins, minerals, and antioxidants, beneficial to longevity. Next, we'll explore which 4 nuts seniors should embrace daily, why they matter, and how to enjoy them every day. Part 2. After understanding the pitfalls, let's shine a spotlight on the top 4 nuts seniors should be eating consistently for their anti-aging benefits and overall health support. Almonds. Almonds are a senior superstar. With about 6 grams of protein, 4 grams of fiber, 74 milligrams of magnesium, and plenty of vitamin E per ounce, they're ideal for supporting bone strength, nerve function, and heart health. Studies show almonds help reduce LDL cholesterol and markers of inflammation, while supporting glucose regulation, critical for older adults at risk for heart disease and diabetes. YouTube, B+E eatingwell.com Plupsi 8 Health for United States, Medium.com Plupsi Real Simple, Complups 3 Healthline.com Plups 3 BBC Goodfood.com Plus. 3.2. Walnuts. Walnuts are rich in alpha-linolenic acid, plant-based omega-3, a powerful anti-inflammatory agent. They also offer antioxidants, protein, vitamin E, magnesium, and trace minerals. Research links walnuts to improved memory, reduced cardiovascular risk, and better metabolic outcomes, making them a cognitive and heart-smart choice for seniors. 3. Pistachios. Pistachios stand out among nuts with their high fiber, B6 vitamin, potassium, and lutein content. They support healthy digestion, blood pressure balance, and eye health. Studies reveal pistachios help regulate lipids, support insulin control, and may even lower colorectal cancer risk in older adults. 4. Cashews. Cashews are rich in magnesium, zinc, copper, and healthy fats, nutrients essential to vascular function, bone strength, nerve repair, and mood. Clinical findings show cashews can improve cholesterol, help normalize blood pressure, and add trace minerals critical for seniors. These 4 nuts, when consumed in moderation, provide a potent blend of healthy fats, protein, fiber, vital micronutrients, and antioxidants essential to aging well. Let's summarize how each supports senior health. Almonds boost bone and cognitive health while reducing cholesterol and inflammation. Walnuts offer omega-3s for brain and heart protection, plus anti-aging compounds. Pistachios balance blood, sugar, blood pressure, digestion, and eye health. Cashews supply minerals for circulatory, skeletal, and neurological wellness. Now that you know the 4 top nuts to eat and the 4 to avoid, let's translate that knowledge into real-life eating patterns. Easy, senior-friendly ways to include these nuts in your day for optimal impact. Portion tip. Aim for a small handful, about 1 ounce or 20-30 grams, providing 160-200 calories. Daily variety is key, but moderation prevents excess fat and calorie intake. Here's a simple, nutritious day plan. Morning boost with almonds. Start your day with a protein-rich base like Greek yogurt or oatmeal. Mix in a handful of almonds to add healthy fats, fiber, vitamin E, and magnesium. This combination supports bone health, steady energy, and mental focus, reducing cholesterol and inflammation. Mid-morning snack of walnuts. Around mid-morning, enjoy a handful of walnuts. Their omega-3s and antioxidants support cognition and mood. Walnuts also reduce arterial inflammation and improve endothelial health with consistent use. Lunchtime sequence with pistachios. Include pistachios, about 20 kernels, with your lunch or a side salad. Their fiber and potassium help maintain blood pressure and stabilize blood sugar. Shelling pistachios slowly encourages mindful eating, inflammation control, and satiety. Evening garnish of cashews. In the evening, sprinkle 8 to 10 chopped cashews into soups, veggie dishes, or curries. Their savory flavor and mineral content support sleep, circulation, and relaxation. Weekly special treat. Add 1-2 Brazil nuts sparingly to ensure safe selenium intake, while avoiding excess toxicity. Avoid peanuts, especially salted or roasted. Snacks, processed trail mixes with high salt or sugars, and excessive macadamias. Keep sodium low and acorn-based fats balanced. Snack hacks. Mix almonds, walnuts, pistachios, and cashews, never peanuts, for a senior nut blend with crunchy texture and balanced nutrients. Stir nut butter, almond or walnut, into smoothies. Use crushed nuts as salad toppers or oatmeal mix-ins. Pair nuts with food for synergy. Walnuts, plus leafy greens for omega-3, plus nitrates, vascular health. Almonds, plus berries for fiber, plant protein, antioxidants. Pistachios, plus yogurt for probiotics and satiation. Cashews, plus leafy greens for magnesium, zinc, and cellular repair. Hydrate. Well, fat metabolism requires water. Balance Kindle mineral. Intake with 1.52 liters of water daily. Portion control strategies. Use small containers or pre-portion your daily nut servings to avoid overeating. Smart packaging helps support calorie awareness. Seniors may encounter chewing or digestive issues. Opt for chopped nuts, nut butters, or added nuts in blended soups to ease consumption. In Part 4, we'll explore long-term strategies. When to cycle nut intake, how to monitor biomarkers, manage allergies or medications, and diagnose signs of overconsumption. You'll learn how to safely personalize nut-related habits to optimize health well into your later years. Part 4. Eating the right nuts every day has immense benefits for seniors, but what about the longer-term perspective? Here are simple, yet essential strategies to keep enjoying these nutritious snacks safely and effectively over years. Cycle intake to prevent imbalance and excess. While almonds, walnuts, pistachios, and cashews are healthy, consuming them too frequently could contribute too many calories or influence nutrient absorption. Try rotating a different nut each season or alternating weeks to maintain variety and avoid nutrient overload, e.g., selenium from Brazil nuts. Pay attention to possible interactions. Certain nuts, like cashews and Brazil nuts, are high in potassium or selenium, nutrients that can interact with medications such as ACE inhibitors or thyroid hormone replacements. If you're on medication for blood pressure, heart conditions, or thyroid health, check with your physician before adding them. Keep sodium and oil content low. Avoid pre-roasted or salted nuts. Choose unsalted, dry roasted, or raw formulations. Store nuts in airtight containers in the fridge or freezer to preserve freshness and avoid oxidized fats, a common concern with rancidity. Watch calorie intake. Even healthy nuts are calorie-rich. If you're aiming to lose or maintain weight, offset nut calories by mildly reducing refined carbs or processed foods. If you have difficulty chewing tougher nuts, choose softer ones like cashews, or enjoy nut butters with a spoon or spread. Listen to your body. Notice any digestive upset after eating nuts, bloating, gas, or discomfort. This may indicate intolerance, sensitivity to fats, or fiber overload. Reduce the serving size, then reintroduce gradually. For peanut or nut allergies, those nuts should be avoided entirely. Periodic testing. If you're unfamiliar with dietary allergens or treat thyroid or kidney conditions, ask your doctor to monitor blood pressure, cholesterol, sodium, potassium, and selenium levels every 6 to 12 months when adopting or modifying your nut consumption. Keep variety. Reduce risk. Rotate between the 4 recommended nuts weekly. 1 week incorporate almonds and walnuts, the next pistachios and cashews. Sprinkle in 1 Brazil nut 2 to 3 times per week, not more. This method supports stable nutrient balance while avoiding overconsumption. Mindful pairing with exercise. Nuts support muscle protein synthesis when paired with strength or mobility exercises. A nut-based snack after walking or light resistance training enhances recovery and satiety. Stay updated. Nutritional science evolves. Follow reliable sources like Healthline, peer-reviewed journals, or trusted health sites to keep current on nut-related guidelines for seniors. Seasonal transitions. During colder months, nut intake helps support calories and bolster immunity. In warmer seasons when hydration matters more, pair nuts with hydrating fruits to prevent imbalances. When chosen and consumed wisely, nuts can be one of the most nutrient-dense, satisfying, and health-supportive foods on a senior's plate. Just be strategic. Avoid peanuts and ultra-processed mixes. Limit macadamias and selenium-rich Brazil nuts, and instead choose almonds, walnuts, pistachios, and cashews as your daily plant-powered allies. These 4 daily handfuls can lower inflammation, support bone, brain, and heart health, stabilize blood sugar and energy, supply essential vitamins and minerals, and encourage mindful nourishment practices. With moderation, rotation, and attention to how your body responds, you can harness the anti-aging power of nuts to support healthy, vibrant longevity.